Hi, this is attorney and nurse practitioner Joe Flores, licensed in the state of Texas, and with the ability to practice law federally, nationwide, with local counsel and the court's approval. Let's dive into health fraud. What is health fraud? Well, on the books, it is any way, trick or device, or some sort of conspiracy to deny the government of money. Lately, you've read about billions and billions of dollars that have been obtained and paid back because of unscrupulous billing tactics in telemedicine and other areas. And let's get into it. Billing for services not provided is the biggie. Doing services that are unethical or upcoding, charging too much for services, and kickbacks. Paying a physician to refer you cases if you're home health. If you are a nurse practitioner, paying people to bring people into your clinic, or if you're doing Botox or whatever, that's not even involved with Medicare or Medicaid, it still can be healthcare fraud if you're acting unscrupulously or fooling the public. And also false claims, misdiagnosing people for the purpose of getting more money from the government. Let me tell you, I'm going to focus in on Medicare and Medicaid, and CMS.gov, that's CMS.gov, is your best friend. It's a treasure trove of information for you all that are practicing. We have ethical duties. We've got legal obligations to monitor for health care. You can become what's called a relator. That's a whistleblower if you discover things in your organization that look fishy. If it's bad, it probably is. If you've got that gut feeling and you see it or you feel it, or the documentation, you're being pressured to admit people for significant services that they don't qualify for, that's also healthcare fraud, up to and including hospice recertifications. Legal obligations in many jurisdictions, this becomes not only a state but a federal issue. U.S. attorneys get involved. And the best thing to do is lawyer up and cooperate. If you think that you were a part of it, the best thing to do is get out of it. Quit the job. You could always quit a job, but you only have one license. Remember that. And documentation. Many whistleblowers need to have pictures, documents, medical records. You say, well, Joe, that's violating HIPAA. Well, if you're providing it for the purpose of healthcare fraud investigation and giving it to your attorney under attorney-client privilege, that is not HIPAA violations in most jurisdictions, if not all. That is helping and assisting the government. So how do we do that? We go to the U.S. attorney, and you must have an attorney to represent you. They file things under seal, meaning the public can't access it on Public Access Court Electronic Records, also known as PACER, and it stays dormant for a while. And then when they have all the goods, they unseal the lawsuit, and nurses can collect between 10 and 30% of what they report as stolen. So remember that. And reporting process, you can do it internally, but if they blow you off, you have the right to go to the U.S. attorney or your state attorney general. So remember, healthcare fraud, we all pay. So remember, keep that in mind. If you have any questions on federal healthcare fraud, contact us at floreslawfirm.com. Visit us on our Facebook page, also on Instagram and other social media. Thank you, and God bless.